Technology, third year from Savitya College of Radiological. Today's main topic is about radiological approach of Takayasu Arteritis. Introduction to Takayasu Arteritis. Takayasu Arteritis is a rare and chronic inflammatory condition that primarily affects the aorta and its major branches. This autoimmune disease can lead to development of narrowed, blocked or weakened arteries, potentially causing serious complications if left untreated. It can also lead to arm or chest pain, high blood pressure and eventually heart failure and stroke. History. It was first reported by a Japanese ophthalmologist at 1908 in Fukuoka, Mikati Takashi. A case of 21 years old woman whose eyelid exhibited coronary anastomosis and arteriovenous anastomosis around the papilla. It is also known as pulseless disease or Mann-Martel syndrome. Anatomy. Takayasu Arteritis. The aorta and other major arteries, including those leading to the head and kidney, can become inflamed. It usually involves the aorta and its major branches, particularly the renal arteries, carotid arteries, and subclavian arteries. Signs and symptoms: night shift, high blood pressure, limb coordination, mild chest discomfort and pain, joint pain, and neck pain. Classification. Based on the location, the Takayasu Arteritis is classified into Type 1, classical type involving the aortic arch branches. Type 2, 2A, involvement of aortic and its ascending portion and the aortic arch branches. 2B, involvement of the descending thoracic aorta and aortic arch branches. Type 3, involvement of thoracic and abdominal aorta distal to the arch and its major branches. Type 4, involvement of abdominal aorta and the renal arteries. Type 5, generalized the involvement of all aortic segments. Radiological findings in Takayasu Arteritis. First one, arterial wall thickening. Thickening of arterial wall is the hallmark features indicating the presence of inflammation and edema. Stenosis and occultation. Narrowing or complete blockage of the arteries can be observed, often affecting the aorta and its major branches. Aneurysmal changes. Weakening of arterial wall can lead to formation of aneurysm, which carries a risk of dissection or rupture. Collateral vessel formation. The body may attempt to compensate for arterial narrowing by developing new small blood vessels. Radiological effects of Takayasu Arteritis. Ultrasound. It plays a major role in early diagnosis of Takayasu Arteritis. A Doppler is used to examine the arterial blood flow and the structure of the blood vessels. By performing the Doppler survey, we can access the vascular status and predict the angiographic finding in patients with Takayasu Arteritis. But in pulse Doppler, stenotic lesions were quantified, ocular lesions were identified, and collateral circulation was demonstrated. Beam mode ultrasonography may depict homogeneous circumstances, thickening of affected vessels characterized by diffuse hypoechoic or isoechoic thickening of the affected wall on the longitudinal scanning. This is the term as micron signing and it's highly specific for Takayasu Arteritis. This thoracic is most conditions, the major branch of abdominal artery are impossible to evaluate by ultrasound. Magnetic resonance imaging. MRI is one of the methods used to often to evaluate Takayasu Arteritis. The utility of this non-invasive technique is particularly high in pediatric patients for whom biological cost and complication of angiography are potentially greater than for adults. In this condition, gadolinium-based contrast MRA may demonstrate concentric or crescent-like thickening of arterial wall and sequence like invention recovery prepared echo gradient pulse sequence with fat suppression. Delayed hyper enhancement is seen in inflamed aortic wall on delayed contrast enhanced MRA. Mural thrombi can be detected more easily on MRA than the conventional angiography. In CT demonstrates a mural thickening with intramural classification identified as the disease progresses. On CT angiography, pre-contrast scan shows high attenuation of the aortic wall. The arterial phase reveals illuminal changes such as stenosis, and the venous phase shows a double ring pattern of the aortic wall. CTA also detects silent coronary involvement characterized by non-still stenosis or still stenosis and coronary aneurysm. The CT differential diagnosis include giant cell arteritis, polaritis nodosa, and atherosclerosis. In this image, contrast enhanced CT image shows the contric wall thickening of the ascending and descending aorta with wall calcification. In this image, maximum initial position of angiogram shows the complete occlusion of both prevertebral subclavian artery, and there is a collateral flow from the right vertebral artery and left cervical artery. Both common carotid arteries are planted. In this image, optical coronal deformation image shows the perfusion of aneurysm in the thoracic descending aorta as well as wall thickening of the descending thoracic of the abdominal aorta. Angiography. Angiography has been considered the gold standard for diagnosis of Takayasu Arteritis. Because of its invention, angiography are not the first line to study of most of the patients, particularly in pediatric patients. Gadolinium enhanced MRA find the diagnostic be strongly suggestive for the disease. Ultrography are the most frequent single focal, smooth symmetric narrowing of the aorta and the multiple branch vessels, stenosis or occlusion, with secondary collateral vascularities or system pulmonary study. In angiography helps not only the initial diagnosis but also for a follow-up. In 61% of patients with clinical inactive disease develop angiographic changes considered with present inflammation disease and angiography follow-up. Fibromuscular dysplasia is part of differential diagnosis of Takayasu arteritis. FMD usually does not affect the aorta. FMD is rare in subclavian artery. Angiography has also been used in interventional radiology procedures such as percutaneous transluminal angioplasty in patients with quiescent disease and clinical stenosis. In this image, narrowing of the proximal descending aorta and the right precursoric artery. Angiographic evaluation of vascular involvement. In first one, aortic involvement. Angiography can precisely detect stenosis, obligation and aneurysm affecting the aorta and its major branches. Limb artery assessment. The imaging modality can evaluate the involvement of peripheral arteries and the upper and the lower limb. Comparison evaluation. A detailed angiography assessment provides a comparison understanding the extent and distribution of vascular lesion. Case discussion. History. A 37 years old man with a history of hypertension, hyperlipidemia or coronary heart disease report present chest pain and back pain for 6 days. In CTA, chest and abdomen involve the aortic recession from the descending aorta with distal abdominal aorta as well as stenosis in many sites including left subclavian artery, abdominal aorta and the iliac artery. Case 2. A 26 years old woman who experienced frequent psychopal attack and lighting illness was hospitalized. Initially just dizziness praised and these psychopes, but at times went on, there were also brief instances of loss of consciousness after psychope. She also expressed concern about malicia, decreased appetites and weakness. In MRA shows the aorta and its major branches and the aberrant thickening of the aortic arch walls, which was roughly 4.4 mm. It was determined that the patient has Takayasu arteritis in an active phase. Type 3, case 3, a 48 years old woman with Takayasu disease, note narrowing of the origin of the right subclavian artery, narrowed small vessel with subsequent aneurysmal dilation of the right side. Role of radiological treatment planning, endovascular intervention, surgical procedures, and ongoing monitoring. Conclusion. Radiological approach to Takayasu arteritis involves a combination of imaging modalities to access arterial involvement, disease, acquisition, complication. Angiography remains the gold standard for monitoring and disease progress, while MRI and CT angiography offers non-invasive alternative for evaluating vessels formation related complication. Collaboration between radiologists and clinical is crucial for interpreting image finding accurately and guiding appropriate management strategies in patients with Takayasu arteritis. These are my references. Thank you.